I'm Emily Sheffield, editor of the Evening Standard, and I'm pleased to welcome Matt Hancock to London Rising. As the government's Secretary of State for Health and Social Care, he has spent the last year working in the eye of the COVID-19 storm, the biggest global crisis since the Second World War. The UK government secured early access to 457 million vaccine doses, and he received his own first vaccine only last week. Matt, like us, went into lockdown, and we spent a lot of time seeing him broadcasting from a tiny little red room in his home that went viral. He was brought to tears on live television late last year when the first COVID-19 vaccines were administered in the UK, and despite the turbulent events of the last 12 months, insists he's still a huge optimist. He's here to talk about his experience, what we need to learn, and how we can future-proof ourselves, this city and our healthcare system against another pandemic, and the role that innovation plays in this. Matt Hancock, thank you so much for joining me.
Thanks very much for having me.
Matt, firstly, I think we can all say we are hugely grateful for the work of you and Kate Bingham and the whole of the NHS. Today in London, we have reached a staggering 5.5 million vaccinations.
Yeah.
I also think that because of you, the nation next week can snog again. And I think we should retitle you the Minister for Kissing.
Well, thanks very much. The vaccine programme is all about getting our freedoms back and getting life back to normal and being able to, do those things we love, like hug and seeing
who would you be first hugging, outside of your immediate family, of course?
Well, I haven't seen my mum since July last year.
So she's booked into the busy diary.
So I can't wait to see her. I'm a fairly gregarious sort of person, and I really want to get back to the sort of, the verve of life.
Yeah.
And I think so many people do, but we've got to be careful about it. We've got to be cautious. What we want to do next week is essentially change the instructions to people to say, here are the risks, you understand the risks. People have been so responsible, and we want to say it is a matter of personal responsibility to...
Who you kiss next week.
Well, that is absolutely a matter for we've been putting in place these rules that you'd never imagine you'd go into politics to put into place.
You are not allowed to go and snog anyone.
People literally are asking us as ministers and public health experts, who can I hug? And that is an extraordinary position for the country to be in. But people get it, right?
Yeah.
2 people who've been vaccinated, if they've had the 2 weeks after the second dose, the risk is very low.
I think most people are going to take it quite carefully. You yourself were vaccinated only last week as your first dose.
Yeah.
And back in January, as the health minister leading the country's operation against the pandemic, you had to self-isolate.
Yeah.
I think that's a sort of curiously British thing. Why was it so important to you that you didn't get the jab earlier than other 43-year-olds? I mean, lots of other health workers were being prioritised. Why not our Minister for Health?
Well, we did talk about this and we did think about it. And there was an argument for being vaccinated right at the start to show sort of confidence in the vaccine. But the truth is, the first few days went so well and there was so much enthusiasm for the vaccine that I decided that the better thing is just wait in turn. And we love queuing, us Brits, and the fairness of the rollout has been really important.
Yeah.
There haven't been complaints.
So you were demonstrating that it was fair that you should wait in line like everyone else.
There's a phrase, we're all in this together,
Yeah.
and it's true of this. And there were some very important people who were vaccinated early, Her Majesty the Queen and Prince Philip, of course, and David Attenborough.
A little bit older than you, though.
Because they were in line. They also were in the queue. So I thought the better thing was to just to show leadership by being just part of the national queue that there's been.
If you were to count up, how many hours did that mean that you ended up in that little red room?
Oh, hours, ages. I mean, I've spent so much time I love my office at home.
Is it really an office? We're all still convinced as a nation that it is actually your downstairs toilet.
No, it is. It's just that the door's at a funny angle, so you can't see it from where I have the computer.
Are you back in your normal office now?
Yes. Yeah. And I get most of my work done there, and it's COVID secure.
And are you encouraging more of your workforce to come back?
Well, that's a matter for employers.
Yeah.
And I think there'll be permanent shifts in the way that people work. Of course there will. And it'll become standard to say let's have that on video conference rather than travelling.
Do you
for
think
instance.
on June the 21st we'll get the message that people can come back to the office though? Or is that going to be a message of personal responsibility for bosses?
Well, again, like with hugging, it will be we're going to be clear about the risks right across the board. But our aim on the 21st is to lift as many of the measures
restrictions as possible.
Yeah.
You are, and I mean this in the nicest way, sometimes almost too optimistic. I think of you as a Tigger, an optimistic Tigger. However, December with the Kent variant, I mean, that did take us all by surprise. Was that your darkest moment?
Yeah. Look, I am an optimist, and I'm still an optimist, and it's actually really helpful to be an optimist in a terrible year like last year, because you can see, I could see the way out, and I always knew we'd get there. But December was terrible, and actually the worst period though, the darkest period was after we'd done the lockdown on the 4th of January, before we knew it would work. Because we knew we had this variant that spread so much quicker than the previous one.
And we didn't know how long we'd be locked down for.
Well, and we didn't know if the numbers would just keep going up. We threw everything at it. We closed the schools, we closed the shops. We did everything we could do to stop the spread of this thing.
But wasn't the moment when the Kent variant came obvious? Because I think things weren't looking that bad before Christmas, and then suddenly there must have been a moment when you sat down and saw how fast things were rising, and this variant had come about. I mean, that must have been quite oh my God, this is going to knock us back.
Yeah, well, we first saw it with this rise in cases in Kent during that November lockdown, where everywhere else it was falling, and there wasn't a clear explanation for why. And then it was Essex and Kent and East London, and then it was the whole of London.
But personally, how did you sort of get your optimism out at that moment? Because your team must have all felt a bit knocked back at that point.
Well, you
knew the wave was going to be hard then in January.
We did, and then the spirit was determination. Really,
we had to get through.
We've got to do what it takes, and we did, and lockdowns are damaging, and nobody wants to do them. But
how much did you rely personally? Because again, you are very optimistic, but you had a family at home. How much do you rely on your family, I suppose, to bring some sort of normality to you when you get home at night?
Well, when you've got teenage children, they do tell you what's what.
Yeah.
So
and keep you busy.
It's quite it's quite grounding.
Yeah.
And that's important.
Yeah. And during the lockdown, I mean, you're working flat out, but you have got 3 children at home. They did need homeschooling. How were you differing up all the tasks at home?
I wasn't much use.
You weren't much use?
No, because I was working all the time. And actually, they were great at homeschool, and they got on with it. They got on with it.
Not too much gaming.
Not that I'm aware of. And
better than my children, I must say.
And there's we were all working. There's a bit of pressure on the Wi-Fi at times, I can tell you.
Yeah, I'm sure. And so no arguments over who unloaded the dishwasher like there was in my house.
Well, I'll keep these things behind closed doors, I think.
I think a lot of, the vaccination policy, which was spearheaded by Kate Bingham and yourself, I think a lot of people would just like to know, what was the moment in the room when you made that decision to buy?
Yeah.
Because other people didn't take that decision, and you did with Kate.
That's right. And I think there were 2 parts to this decision. Yep. The first was the decision to set up a team and get entrepreneurial outsiders, experts, the scientists, as well as the civil servants, who were critical to it too.
And what time of year are we? Where is this last year?
This
March,
was
April?
about March.
Right.
But then the earlier, and that's, we brought in Kate Bingham, and she was brilliant and drove it along with many others, a big team effort. And then the other moment that was critical was much earlier than that. I was talking to JVT and Patrick Vallance about a vaccine in January, and the discussion started with saying, well, it would normally take 5 years, and then we could do it if we get everything right within 12 to 18 months.
But this idea to just buy, you didn't know which of those vaccines were going to work, but
No.
you just put your orders in across. So who decided that? Like just mass ordering?
Well, we decided collectively that the best thing to do was to buy at risk.
Okay.
And that is unusual in government. Normally, you make sure something's definitely going to work.
Yeah. And was that hard? Was that a hard decision
No,
for you
it was
to
a
push
really
through?
easy decision. It was
And easy to get it through government. Like no one stopped you. No one said
nope.
this is a bad idea.
Everybody totally on side.
Okay.
And the reason it was an easy decision is that lockdown was costing the economy about $4 billion a day. So anything that could reduce lockdown by even one day, as well as, of course, saving lives.
Even if there was some wastage, it didn't matter.
So
the balance was going to be huge.
And remember, everybody now talks about the great successes, the more than 100 million doses, the fact we got both the Pfizer and the AstraZeneca jab, the two early ones. But remember that we backed lots of projects that didn't come off.
No.
There was a brilliant imperial project led by Professor Robin Shattuck, a wonderful scientist.
And a couple of the vaccines haven't come through either.
That's right. GSK, Sanofi have not yet brought their vaccine to conclusion. So we backed horses that won, but we backed horses that didn't either. And I think there's a lesson in that for how governments should operate.
You have to take a bit of risk, At times, your views, well, certainly sitting from the outside, were definitely pitted against the Prime Minister and especially Rishi Sunak, who opposed lockdowns and launched Eat Out to help out. You were more for lockdowns and cautions. How heated were those discussions? Well,
I think what I'd say is that we were all wrestling with really big questions. So, of course, there were serious
Robust
debates. But we all had the same goal, which was to get Britain through this as best as we could. And so they weren't heated. They were the issues were properly debated.
But did they go on a long time? I mean, these were very, very, very serious issues you were talking about.
Yeah. Well, there was a constant debate for a year. But we clung to the strategy that you had to suppress the virus until the vaccine would make us safe. And my big sort of bet, if you like, my view, my belief was that the vaccine would come through, even though no coronavirus vaccine had ever been developed before.
Okay. There's been a lot of rumour around our Prime Minister saying, let the bodies pile up. Did you ever have those discussions with him? And was it bodies versus economy at any point?
No, I never heard him talk in those terms. And, the Prime Minister has to weigh these huge decisions where there's great weights on both sides of the scales. And we all do, of course, but my job is to articulate the health imperative. And he has to balance these things. So the decisions were much more nuanced than that.
And fluid, given the data that was coming through.
This is the other thing, right, is that more than anything else I've ever done in government, you're operating in a world of uncertainty. Communicating that uncertainty is hard, even now. Communicating it and discussing it internally when you're operating in a world where there's huge unknowns, it makes the judgments harder. And in some cases, you could see the known negative impact of an action you had to take, but the positive impact you couldn't be sure about.
Was harder to spot.
So that's a really difficult situation to make a judgment like this.
Can you see Boris Johnson as Tory leader for a decade?
Yes.
Would you stand again when he goes?
Oh, come on, Emily. He's not going. I mean, look at the results last week. Absolutely fantastic.
Does it annoy you that Rishi Sunak gets a better rating for handling the pandemic when all he's done is sign cheques?
Oh no, that's not fair. Look at furlough. Furlough's been an absolutely incredible scheme.
You have done brilliantly as well.
It's been a big team effort.
Do you see Rishi as a likely rival in the future?
I think I see him as a great partner in trying to steer the country through these difficult times.
Tony Blair's advice on first jabs being optimised was taken up by the government.
Oh yes.
How did you two communicate at the time?
Well,
texting.
I talked to all of the former prime ministers. They've been in situations of great tension and national difficulty, all of them. And I learned something from each and every one of them. And I think that's important, and I think it's good for them.
Did you find some of the advice helpful though? Because I mean, he did have a big team, was able to stand back a bit, I suppose. From all of you were in the pit, as it were.
So both that, but also just the perspective of how to make decisions in such difficult times as well. And and to cope with the different pressures.
Yeah. Do you think like him, or rather his team, do you think another pandemic is inevitable? It's
Yes,
sort of when,
I do.
not if.
Yes, I do. I think, given that the last one was only a decade ago, albeit it didn't hit Britain very hard.
SARS.
Yes.
Yeah.
I think it's inevitable, and we've got to be ready, and more ready than last time, and hence, making sure we've got vaccines that can be developed in 100 days, and the onshore manufacturing.
And that's one of his suggestions, and publish a clear strategy on what the frontline need for PPE. I mean, is that possible when you don't know what strain it will be? I mean,
I think that
that's a sort of movable.
Yeah, we can make sure that the thing on PPE was that getting it, the delivery system for getting it to the front line needed strengthening from right at the start.
And is that something you can future-proof against?
Yes.
If you don't really know what the virus is going to be, though? Or
yes, because we now have a far better system of understanding what PPE we've got when it arrived, what exactly all the details are, making sure we can get it logistically to the right places, putting in place all of that structure, which just wasn't there. We had a big warehouse full of PPE, but we didn't have the distribution mechanisms that you need, and that's important. So whether it's on testing, having the big diagnostics capability, on PPE, also we now make 70% of PPE onshore rather than getting it from China.
Okay.
On vaccines, both the research and the manufacturing.
So if there was another pandemic or a new variant, we would be able to produce PPE here much faster and get it out to where it was needed.
There's no doubt about that.
Okay. PPE. Obviously, some questions have arrived about how we got some of this equipment. Questions are unlikely to stop over the VIP list. If you went back, is there one thing you would do differently now? And you're being asked to hand over your WhatsApps and text messages. Is there anything in them that might be embarrassing?
Well, no, because I know for absolute certainty that everything we were doing in that period was to get as much PPE to the front line as possible. And of course, that meant that when a good lead came in, we put them urgently into the system, and we had a system for doing that. But ministers didn't make the decisions on which contracts to strike and who to buy from. But absolutely, if somebody came forward, and I remember, some of the people in opposition parties who've been complaining about this were coming forward saying, you haven't spoken to this person, you haven't spoken to that person. Of course, we had a system for prioritising.
People did want to help.
It was a national effort. In fact, I went on the TV.
But you're not worried about handing over your WhatsApps and texts?
Do you know what? When the moment comes, people can see. We're completely transparent. And when people, throw brickbats at me for pushing hard to get PPE, I just ask you to think about the nurse on the front line in King's Lynn or wherever he or she is, who needed that PPE, and we were this close to running out as a nation, and we never did, thanks to the work that went on in that time.
But if you did it again, would you do it differently? Because we'd be better prepared this time.
Well, if another pandemic struck, on PPE, on testing, and on vaccines, would be able to move much faster.
Much faster.
And on the other area where we'd be able to do better is the data, the analytics, understanding it. People have said for a while that government is not good enough at using data well. And during the pandemic, we built up some of the best analytical systems I've ever seen.
So we'll be better at processing data going forward.
And that leads you to understand where it is. So, for instance, this Indian variant that we're worried about at the moment, we know about it, we know where the cases are, we know whether they're linked to travel or not. We have so much richer data and good ways of visualising it, and so you can make better decisions. And that's one of the things we should learn and we should replicate in other parts of government.
If something came up like the Kent variant again, that spread even faster, would we be able to lock it down fast enough?
We'd be much better placed to stop it sooner. A good example is the South African variant. What about 2 months ago was shooting up quite fast. And we stopped flights and travel from South Africa and large parts of sub-Saharan Africa. And we did mass testing in southern London, around Wandsworth and Southwark, and those cases have levelled off and, if anything, are now falling slightly. That response was possible because of the data.
And you've probably got a population who are happy to act quickly.
Well, the whole nation's learned, and I think this is one of the reasons why why some of the South Asian and East Asian countries were able to respond quickly at the start, because they'd been through SARS, and so everybody understood what a pandemic means a bit more.
Have you kept a diary, and will you be publishing a book?
No, and
what?
Well, no, I know, but I was too busy. I mean, I wish I'd kept a diary during of the vaccine programme, because it has been this extraordinary
But even for the history books,
programme.
I mean, you were right there.
I know,
Matt, that's very disappointing.
Well, what I did, Emily, is in the morning I got up and I thought, what do I need to spend my time on to get this, to do as much as we possibly can to get this right? And then I did all that, and then I went to bed.
You're launching the UK Health Security Agency in September. It was going to be launched in April. How can you ensure this is going to have strong leadership and be fleet of foot like the vaccine buying was, not hindered by bureaucracy? And where are you going to get the funding for it?
Yeah, so the UK Health Security Agency is a really important part of learning from what we
Would you just explain, I guess, what the UK Health Security Agency is going to be doing?
So the UK Health Security Agency is there to be the single organisation whose job is to wake up and worry about pandemics, both in the middle of the response to one like now, and in the years when there's no pandemic on the horizon, when you still need a group of people worrying about what happens the next time one hits. It's being led by Jenny Harries, who is both hugely experienced in this area, but also determined and go-getting, and she's building it now. She's putting it together.
Is it going to be properly funded? Because otherwise it could just, in 5 years' time, we've all, well, not forgotten the pandemic, but, it'll get shunted aside for more urgent things.
Well, that's why it's so important, I think, to have an agency whose only job is to do this. One of the...
But are you going to ring-fence money for it? Because that's going to be the worry, that it won't get properly funded.
It absolutely ought to be. That we've got to sort that in the spending review, so it's not a...
it's not something that can get chipped away at.
Well, at the moment, the job is responding to this pandemic. We've got to make sure it's set fair for the future as well, and that's a matter for the spending review.
Can you imagine for us what life might look like in a year? And in that, I mean slightly, I suppose, post-pandemic effects. COVID passports, mask wearing, variants popping up.
So in a year's time, I hope that this pandemic is behind us. I think we're going to have a great British summer this year. But I of course worry about getting through next winter, because it's obviously seasonal, this virus. But by this time next year, a large swathe of people will have had a booster jab. That means we'll be able to deal with variants, not just the existing strains. And I think we'll be back to life as normal. Now, I want that to be as soon as possible, but we're also, realistic and
still
careful.
in a global pandemic,
But whether or not this will have been dealt with everywhere, I don't know by this time next year, because we've got to make sure that the vaccination happens across the world. And if you think about it...
Will we be giving our spare vaccines away?
Yeah, but we're doing something much bigger than that, which is, because the Oxford AstraZeneca vaccine is given at cost around the world, we are vaccinating the world already. 150 million doses of the Oxford AstraZeneca vaccine in India now. That's the contribution we're making. In fact, just this week, there's a absolutely absurd protest by a group calling themselves Global Justice Now outside the AstraZeneca headquarters in Cambridge. They are calling for the AstraZeneca jab to be made available free to the whole world. AstraZeneca have already decided to do that. Their whole premise is that they are making this available with no charge other than the cost of actually producing the vaccine.
Do we think President Macron feels a bit silly now?
Well, I think that we should be really proud of ourselves as a country. And the thing I'm most proud of is just how many people are coming forward and getting jabbed. Over 95%. Amongst the over 70s, it's nearer 98%. It's amazing
it's amazing
how everybody's stepped up.
And you have continually praised the London spirit in handling the crisis. And back in March, you did that. There have been 15,000 deaths here. Unemployment hit very hard, and the employment figures are not looking great for September, because of the way our jobs here, a lot around hospitality. I think a lot of Londoners could be forgiven. They're hearing quite a lot of anti-London rhetoric from our Prime Minister right now. A, do you think that's the right thing to be doing? And B, does our Prime Minister even recall he was mayor?
I think that the spirit of London in this pandemic has been incredible. And if you think about it, the levelling up agenda that the Prime Minister is so passionate about is about making sure all parts of the country benefit from the growth and prosperity that we've seen over the last few years, pre-pandemic here in London, to such an extent, including, of course, the 8 years when Boris was mayor. And making sure that spirit.
But do you think it's right that cities could maybe feel, some of whom have been hit very hard, I just feel like they're not getting enough praise at the moment?
No, because the whole point of levelling up is...
It's not just all about northern towns.
No, but the whole point of levelling up is to make sure that the whole country can advance. It's a philosophy of life. It's a philosophy of government, which is not to do down an area. Because we want Teesside and Hartlepool to do better, and lots of other places too. That doesn't mean you don't want London to grow spectacularly and be vibrant and exciting. And some people make the argument. Maybe the Prime Minister
needs to say that a bit louder.
Well, some people make the argument that things should be equalised more. With some up and some down. I don't agree with that.
No, I don't think Londoners want everyone to level up.
To prosper and do better. Yeah. So let's do that.
Do you think working from home has health benefits for Londoners? And how much of this do you think is going to be the norm?
Well, I do think the norms are going to change. But I think that's not really a matter for me as a minister. It's how we live our lives.
But health benefits, do you think?
Well, there's definitely some health benefits in terms of air pollution, the impact of that. If you're not commuting, then you can take more time out for exercise. There's lots of changes that won't go back because they're better for us all as a society.
Yeah. Obesity. This was a problem brought to the fore again by COVID. Something the Prime Minister does now seem to be behind. The Cameron government did the sugar ban in fizzy drinks. What big headline move might you make against sugar?
Well, the action to remove advertising where it's targeted, especially where it's targeted at kids, I think is important. But there's a more important and bigger change that we want to see, which is that the way the NHS operates and the way its budgets are structured, it really goes after fixing problems, health problems, once they've arisen. That's the way that it's organised.
And we need to do preventative.
We need a preventative health system. So it's not the National Hospital Service, but the National Health Service keeping people healthy in the first place. That's what the bill announced in the Queen's speech is all about. And it's all about helping to get the money out into communities, supporting people to stay healthy in the first place. So it's not just about individual measures to tackle obesity and keep people healthy. It's actually about how the whole health system operates.
That's quite a big...
Yeah, it's a big reform.
Yeah, it's a big reform.
It's exciting coming out of this pandemic because we've got positive reforms of the NHS, in public health that we were talking about, in terms of mental health support as well. Right across the board, and in the use of technology in healthcare, right across the areas I'm responsible for, we have big reforming agendas.
We've got time for 2 more questions. So I'm going to do one on health tech. In March, you unveiled a fresh plan to invest in the digitisation of the NHS. The NHS is not known for being nimble, but it's had to be this past year. Fast-track tech such as track and trace, online vaccine bookings, GP video consultations. If you were to say, what would be the sort of, 2 things the NHS maybe have learnt from the last year, positive things?
Yeah, I think this is incredibly important that the NHS uses the best of modern technology. I think 2 things that everybody has learned in the NHS. One is to embrace technology and to see its benefits and look for its benefits, which hasn't always been the culture before. The second is about collaboration. And of course, Zoom or other video conferencing facilities are available. That helps collaboration because you can get, if you need 20 people in a meeting, you can get them all on a screen much more quickly. That sort of collaboration in London across the whole city, so that, for instance, cancer treatment could carry on in the second wave because all of the hospitals worked together to put cancer patients on safe sites that didn't have COVID patients. Yeah. That sort of collaboration underpinned by technology, and then the embrace, looking out for new technology. These are the two big changes that I saw in how the NHS operates. They're changes for the better, and we've got to keep them.
And patterns of behaviour, one assumes, rather like us with home working more, that they've been built into the NHS now. So
well, that's right.
These reforms should be easier to make.
Absolutely, and you know, a lot of,
because it's a mindset that might have changed.
Exactly, in a big system, a lot of the culture, the mindset comes from actually having the relationships, actually working with people. Yeah. And the vaccine programmes really entrenched that because it isn't individual GP practices doing it on their own. They come together in groups, they work with the local hospital, and these relationships are so much stronger because, you know, the whole NHS has been through this crisis together. Yeah.
Last question. How should the nation show gratitude to Whitty, Balance and his pal JVT? Would you like them to be made peers?
Oh, well, that's a matter for Her Majesty the Queen. These three and many others have given enormous service to the nation, and there's, you know, I know they're modest people, and they would not ask for it. Yeah. But I hope they get properly thanked because they deserve it. In the right way.
Brilliant. Thank you so much, Matt, for coming in. You are incredibly busy, so incredibly grateful for you coming here and spending some time with us. And thank you, everybody, for joining us.